Hello and welcome. My name is James Hill. I'm with ABC7 here in Sarasota. We are joined by a special guest, and she is Dr. Lisa Merritt, MD. Doc, first and foremost, I hope you and your family are well. How's everybody doing?
Well, I thank you for asking. We're holding steady right now, and we are grateful for that.
Awesome. Over the last few years, mankind has been challenged with a pandemic. The COVID-19 pandemic has been around for a few years, and we've wrestled with that. From a medical perspective, can you take us into the pandemic and what we're seeing, particularly at this point in the pandemic, and we've experienced it and endured it for the last few years?
Well, thanks, James. It's a pleasure to be here as always, and I appreciate the opportunity for the media to help provide good and truthful information for the public to make its own best decisions. The biggest challenge has been the misinformation and confusing information that then people don't really know what is going on. So from a medical perspective and from a person working the front lines and working with colleagues across the country and having lost family members and colleagues, I can tell you the pandemic certainly is real, and the pandemic is definitely not over. We're still losing 300 Americans a day to COVID-19. We still are seeing our hospitals at anywhere from 90 or more % occupancy rate. We have close to 80 inpatients right now at Sarasota Memorial with COVID-19. What we are seeing is the success of public health efforts in education, the fact that when people are infected, they stay home and isolate and don't be part of the chain of transmission. The fact that people wear masks in congregate environments as recommended by the CDC to avoid transmission of the highly contagious new subvariants that have mutated because of continued infections. And most importantly, we are so grateful with the rapid development and implementation of an effective vaccine and having achieved a fairly high rate of protective vaccination, particularly in our vulnerable elderly population, such that now when we are seeing infections, we are not seeing quite the level of hospitalizations and death and ICU overutilization as we were seeing last summer this time. However, we're still seeing that close to 60% of currently hospitalized patients, even in our region, are amongst the unvaccinated individuals. So we still feel very strongly that people should be vaccinated. Certain subpopulations, like the African American and the young populations, are still running barely above 40% vaccination. And unfortunately, we're seeing higher rates of hospitalizations and deaths amongst that population as well.
When we look at two neighboring counties, Sarasota and Manatee, the so-called Suncoast, can you just talk a little bit about this particular region, these two particular counties, and what that looks like in terms of the pandemic and going forward? What safeguards do we need? More vaccines, mask up, wash up, stay home? What do we need to do?
What we need to do is to let common sense prevail. We need to let physicians and medical experts be the voices of reason and advice for patients and their families. We need to know that there are treatments now available. There are specialized websites set up through the consortium, the Multicultural Health Institute, which I'm the executive director and part of the Multicultural Action Team, is a member of a coalition along with Sarasota Memorial Hospital and a variety of other organizations across both counties. We're trying to get the word out for people. Number one, we can reduce the length and severity of illness if treatment is received early on within the first 5 days. However, Paxlovid has to be prescribed by a physician, and it's only for high-risk people, and there are a number of exclusionary conditions that people shouldn't take that medication if they have. On the other hand, there are also monoclonal antibodies. There are a few options there for people who are high risk, cancer patients, people with immunocompromised, et cetera. And again, that should be under a physician's direction. And we're trying to get that information out to people so that if someone is positive, if they are infected, that they can have access to this treatment quickly and therefore reduce the burden on the hospital emergency rooms, as well as the potential for further transmission by shortening the course of the disease. We're very concerned that there's a sense that it's over People don't need to protect themselves because there's been an overemphasis on the importance of return to business as usual without looking at the public health ramifications of that, which we saw last summer and we're seeing again this summer. After the main holidays, there's a surge because of unmasked, unprotected interactions in close congregate settings. I even had a case of a person that was in an outdoor dining situation, but it started to rain and everybody gathered closer in. Even though the windows were open, they were still in close proximity and a transmission was sustained and they became positive. What is good is that people who are vaccinated and boosted are not ending up in the hospital. However, they are getting sick. And let me just state, even in my own family, unfortunately, I've had fairly high functioning, athletic, physically fit people vaccinated running fevers of 102, 103, sweats, exhaustion, etc. And most importantly, I'm concerned as a member of the American Academy of Physical Medicine and Rehabilitation Board that we have put out a special consensus statement, and we've also helped with the White House in terms of the ongoing recommendations regarding the pandemic, that there is a huge need to look at the potential for long haul COVID and to look at complications like cardiovascular complications, and to bear in mind that certain subpopulations, especially Black and Brown populations that have higher rates of high blood pressure, diabetes, which are also conditions that increase people's risk to have COVID and have complications from COVID. Therefore, we need to be on the lookout for long haul COVID, post-acute syndrome. And so that's something we're trying to get that messaging out through aapmnr.org and through working with our various colleagues, that because of the number of infections, the high rate of infections in this country, upwards of 80 million, when you look at one in 4, 1 in 5, depending on which projections you're looking at, may be at risk for developing long haul COVID, it is still very important to try to prevent contracting COVID and certainly transmitting it to high risk individuals.
Dr. Merritt, the young population, if you will, children, at the beginning of life through the age of 10, and those who are eligible, so to speak, for vaccines at this point, 5, 6, 7-year-olds. When you look at the younger population, what do you see, and what's the thought process with safeguarding young people here on the Sun Coast and in Florida and beyond?
Well, I'd really like to get back to the concept that informs the roots of my training in family medicine and community medicine, and that is the concept of community care. Too much emphasis has been placed on the perception of personal risk, particularly amongst the younger population, weighing out, well, to what degree might they personally be at risk for either contracting COVID or having difficulties with COVID, when it is a far more complex situation. Young people, particularly in multi-generational families, particularly in educational environments, daycare environments, athletic situations, can be incredible vectors or transmitters of COVID-19. And we have certainly seen that in the last 2 years, where grandparents ended up in the hospital because of impact and exposure from grandchildren coming to visit unvaccinated family members, meaning well, but bringing the virus to them. And so it's very important that we, in the same way, require and see the benefits of vaccinating our children against previously really difficult diseases that used to cause widespread illness, complications, and long-term sequelae, like measles, mumps, rubella, polio. I mean, there was never any controversy. That's part of going to school. You take those vaccines, you protect yourself, you protect those around you, you don't transmit those diseases. The same attitude approach is there with regards to COVID-19. We want to protect our children, and in doing so, we also want to protect our communities, because children go out and about, and they can be a means of further transmission as well. And certainly for children at higher risk, again, the majority of children who have died of COVID-19 or had complications are children of color, because they have higher rates of asthma, diabetes, and other comorbidities. Even high blood pressure is higher in young African-American male adolescents. All of those things are higher risk for susceptibility to COVID, as well as complications from COVID. And unfortunately, we're not necessarily yet seeing a pattern that people that have more severe disease are at greater risk for post-acute sequelae of SARS-CoV-2 infection, or PASC, otherwise known as long COVID. We're starting to see people with long-term symptoms of fatigue, brain fog, pain, cardiovascular issues, instabilities, who may have had very mild infections or unknowingly had infections and only later found out that they probably had a COVID exposure and infection because now they're dealing with long haul issues. So for young people, it certainly behooves them and their family to protect them if possible, to not contract this and to not perpetuate the transmission, because it's through this continued chain of transmission, these worsening and worsening mutations are arising that are increasing the ability of infectivity and widespread impact.
Dr. Merritt, in closing, are there any final comments you would like to make as we think about the ongoing conversation of the COVID-19 pandemic, the coronavirus, if you will, and COVID? And here we are in 2022, and of course it was coined COVID-19, but any final comments?
Yeah, I would like to again urge people, if they know of someone who is positive, to look on our website at the Multicultural Health Institute, www.the-mhi.org, or smh.com/treatcovid, to find out where and how they can proceed with early treatment within the first 5 to 7 days if they find themselves in that circumstance. And more importantly, I want to speak to the need for continuing routine care, which has been terribly disrupted and contributed to further disparities and inequities in populations. Things like getting the diabetes under control, blood pressure medication, eating healthy, doing an exercise routine to keep your stress levels down, to continue to seek your routine care. And if the Multicultural Health Institute can be of assistance, we have a care navigation coordination program. We've been helping to bridge the many disruptions in care for people. And it's important also to remember that we are stronger together, that working together amongst organizations and throughout community, and to think about the best for the entirety of the community is the only way we're going to get out of this together. Early on in the pandemic, Melinda Gates had a very important statement, and she said, the world is not going to be free of COVID until everyone is free of COVID. So we have to keep that mindset in mind as we work together to overcome this terrible scourge that has devastated and impacted our community in so many ways.
Well, folks, there you have it from Lisa Merritt, MD. We thank you for everything you are doing. I'm James Hill. Thank you, folks. We'll be right back.